For our 2015 call for proposals, this is, like I said, our first open call for proposals, and it's very exciting. We view this as a way to help support many of the great ideas that we've heard about during our strategic planning around the state, as well as a way to learn more about what we can do in future years of programming. So we hope that you'll start that conversation by applying for funding this year, but also recognizing that as a permanent resource and a very new foundation, we're going to continue to evolve our programming in response to the needs that we learn about through strategic planning and through this call for proposals. We plan to give out more than $1 million, between $1 and $1.5 million, and that'll be given out in 1 to 2 year long grants. The maximum grant is $25,000 for 1 year and $100,000 for a 2-year term. Most grants, we think, will end up being less than $50,000. We won't give very many above that amount. We have 3 major focus areas, and we'll go over these in detail in the next few slides. First is behavioral health, which we include mental illness and drug and alcohol use in that. The second is American Indian health, and the third is what we're calling partnerships for better health, and we'll talk to you about what that means. To be eligible to apply for funding, you need to be a Montana-based organization that meets these criteria. You either have to be a tax-exempt 501c3, a tax-exempt educational institution, or a state, tribal, or local government agency. Please note also that for the American Indian Health Focus Area, we're asking that eligible entities also be either tribal government agencies or American Indian-led nonprofits. Eligible applicants can plan to use part of their budget for contracts with another entity or organization that might not otherwise be eligible, such as an out-of-state organization. You can, as you go through the application process, if you have more questions about that, please contact us for guidance. So a little bit on what we don't fund. And again, this is all available on our website. We will not fund individuals because they would not qualify for those eligibility criteria I showed you on the previous slide. We won't fund projects that are focused primarily on capital campaigns or fundraising events. We won't fund the correction of operating deficits or retirement of debt. We won't fund construction projects or real estate acquisitions. And let me make a special note on this. This is for this year. We've heard a lot about the need for capital funds for the construction of facilities that would deliver, for example, mental health services or drug and alcohol treatment. We may, in future years, consider funding construction projects. This year, as our first year of funding, we are not going to do that. We won't fund organizations that discriminate by reason of race, religion, gender, national origin, sexual orientation, or political orientation. We cannot fund lobbying. We can't fund political activities as defined in the Internal Revenue Code. We won't fund large equipment purchases, so projects that focus on purchasing large medical equipment, for example. We also will not fund medical research or research that lacks a direct, targeted, and practical benefit to Montanans' health. And finally, we won't fund grants that are intended primarily to be redistributed via subgrants. Again, there's some technicalities there that we're happy to go over with on a project-by-project basis. You can use part of your funds for a subcontract or a subgrant to a specific organization that you need as a partner in your project. But we wouldn't give a grant just so that you can go and make and re-grant those funds wholly. One special restriction that we're required to note to you by law, and also we found in researching this issue that it's also a foundation best practice, our funds cannot be used to supplant government funds. We don't want them to be used to supplant other sources of funding. So what does supplant mean? Supplant really means, in essence, to replace. So if you have government funding for an activity, you're not allowed to use the Montana Healthcare Foundation's grant to replace those funds and then use the government funds for something else. You are allowed to use our funds to supplement or augment funding. So if, for example, you've got funding for a specific program, but you'd like to expand or accomplish specific new deliverables or outcomes that you can't accomplish with your current funding, you can add our funds to those to accomplish those, and that's supplementing, and that's allowed. Supplanting is not. These are the things that we'll be looking at as we review each proposal that we receive. We'll look at the importance of the health issue that you want to address. We'll look at the potential for your project for a 1 to 2 year investment from the foundation to support your project to achieve change that lasts and endures in some way beyond the term of the grant. We'll focus on creating and strengthening partnerships which we believe are essential to addressing the needs of Montana communities, particularly the rural communities that often struggle with funding and staffing challenges. We'll focus on at-risk populations and health disparities. We'll be looking for practical proposals where a clear evidence-based solution exists, where it's workable in Montana and culturally appropriate, and where the project that is being proposed is feasible and that the funding that we can provide is at the right scale to achieve the outcomes that you're hoping to achieve. We're also looking for each project to contribute to a diverse grant portfolio. And when we think about diversity, we mean types of communities, geographic regions of the state, types of health issues, et cetera. Our 3 focus areas are behavioral health, and again, that includes mental illness and drug and alcohol use, American Indian health, and partnerships for better health. We'll go over each of these in a little bit of detail now. In our strategic planning process, which took us to communities around the state to talk to health experts, community members, public health departments, and the like, we heard again and again about some of these key challenges. The high suicide rate in Montana, which Montana has among the highest rate of suicide for any state in the country and has for many years. Adverse childhood experiences. According to one study, the rates of adverse childhood experiences in Montana are among the highest of any state, and we know from many good research studies that adverse childhood experiences can drive behavioral health and chronic illness throughout the life course. Driving while under the influence and binge drinking, which is also connected to high injury rates and mortality on our roads. Shortage of behavioral health providers, particularly in rural Montana, a problem that many communities face. Reimbursement and funding shortfalls that make it difficult to recruit and retain providers, again, often a very intense problem in rural areas. Traumatic brain injury and post-traumatic stress among returning veterans, and Montana has among the highest per capita populations of returning veterans of any state in the country. And also among alternative high school students, students in programs or separate schools in the public school system, which are created for kids who are struggling, kids who may have a problem with substance abuse or behavior or be near dropping out of school but not quite there yet. Students in those groups, according to a study by the Office of Public Instruction, have extraordinarily high rates of depression, substance abuse, and attempted suicide. And so we're particularly interested in programs that might serve that very high-risk group. So this is just some examples of projects that we consider very promising. We aren't dictating to you what you can apply for. If you see an area that's not on this list that you believe meets our general selection criteria, then we encourage you to apply. This is, again, what we learned about as some of the most promising areas in our strategic planning, but we will consider all of you experts and expect to hear lots more ideas from you. So collaboration between mental health centers, health departments, hospitals, community health centers to strengthen services and improve efficiency. You'll see this theme come back under the Partnerships for Better Health focus area. We heard again and again in rural communities where each of these institutions might be struggling on its own with funding issues, staffing, the need for facilities, and yet frequently are not working together to think about how could we share resources and use resources more efficiently to strengthen the system that serves this community. We'll encourage people to think about how they could do that. Jail diversion has proven a very successful way of both reducing recidivism and getting mentally ill people who enter the correction system appropriate care and improving mental health outcomes as well. Prevention and treatment for drug and alcohol use during pregnancy. We've heard from communities around the state that drug and alcohol use in pregnancy is a severe problem, and we're very interested in looking at programs that have a high potential to address that issue effectively. Pilot programs that would better address the needs of patients with dual diagnoses, substance abuse and mental illness together. Schools that are interested in developing behavioral health interventions for alternative school students. We think there's great potential there. Schools can, in theory, bill Medicaid. We believe that this extraordinarily high-risk group of students could be very well served if schools were able to, either by themselves or in partnership with local healthcare organizations, develop programs that would serve the needs of these students on site. And partnerships outside the health sector. So, for example, with housing, we know that among the most important risk factors for poor outcomes from mental illness are the social and economic challenges that patients with chronic mental illness face. And we're interested in programs that would in some creative way address those needs. Turning to our second of the three major focus areas, American Indian health. Some of the key challenges that we heard about from tribal leaders, tribal health directors, urban Indian centers, and community members include inadequate funding of the services that are available. The Indian Health Service has long been recognized as being among the most poorly funded of our public health systems in the U.S. The tribal health systems also struggle to find adequate funding for their programs. The limited availability of drug and alcohol treatment, the challenges facing young families, including historical trauma, a lack of economic opportunity, and adverse childhood experiences, traffic injury and risks that include driving under the influence and relatively low rates of seatbelt use in some parts of the state, diabetes and obesity, which statewide are at relatively low levels compared to other states, still not nearly as low as we would like, but on some of the Indian communities in Montana are quite high, and suicide and mental illness. Again, some of the issues that we heard in conversations with tribes and tribal members throughout the state. So again, these are just examples of projects and issues that we would consider funding. We really do look to work with tribes and eligible tribally controlled organizations to define the projects that they think are most important. So we'll hope to hear from all of the urban Indian centers, from the tribal health departments, from tribal nonprofits, what they think is important and how they think that they can address the health needs of their communities. These are some of the issues that we heard again and again. Helping tribal health departments to strengthen and develop solid sources of funding so that they aren't always turning to a 1 or 2 year grant to solve a problem that needs a longer-term fix. So we think there may be some opportunities just to help tribes with something that may sound simple on paper, but isn't always, such as Medicaid billing. Public Law 638 allows tribes to take over from the federal government services such as those provided by the Indian Health Service, and this may also prove to be a way that if we help tribes use Public Law 638, that they can then go on and develop more stable sources of funding for the programs that they'd like to have available for their people. Health system planning, I think we recognize that when you're struggling with funding shortfalls and short staffing, it's hard to take time out and take 2 steps back and look at your system and think, where do we want to go? So we are willing to offer grants that would allow people to do a little bit of that and think, you know, what's our 2-year goal, what's our 5-year goal, and where would we like to be in 10 years, and what steps do we need to take to get there. Projects that would seek to improve maternal and child health outcomes. So, for example, delivering services for people who are using drugs or alcohol in pregnancy has proven to be a very effective way to reduce neonatal exposure to drugs and alcohol and to help moms get sober and get functional. Injury prevention programs have proven very successful in some communities. I understand, for example, on the Wind River Reservation that a partnership with the Department of Transportation has really helped reduce their traffic injury mortality rates. Urban Indian health programs are often underfunded and provide tremendously successful and important programs, and so we're interested in ways that we can strengthen those programs. And culturally specific disease prevention, treatment, and wellness initiatives that will take what we know from the evidence at a national level but adapt it to the needs of a specific American Indian or Alaska Native community. Final focus area is what we're calling partnerships for better health. Here are some examples of key challenges that we heard again and again around the state are the limited access to health services in rural areas, workforce issues, that it's hard to recruit and retain staff, that in many areas of the state people are nearing retirement and it's hard to replace nurses and doctors and other health professionals when they retire. That funding and low rates of reimbursement for mental health and primary care can contribute to the workforce issues and just make services in general harder to access. And health disparities, the higher risk of illness among socially and economically disadvantaged communities, racial and ethnic minorities, children, and older adults. We think that there's tremendous opportunity through partnerships to improve outcomes. So care coordination, for example, implementing a care coordination and outreach program where pilot funding could lead to a long-term investment by the local health system. Sometimes patients who end up in the hospital and ER frequently can really benefit from what's often referred to as a higher touch system where there's a nurse or a community health worker that really gets to know each patient individually and what their needs are and figures out how the system can serve them a little bit better. Patients that have complex medical needs, often called superutilizers, evidence-based approaches to reduce ER and hospital use and improve outcomes in that population. Other types of collaborations between health departments, hospitals, community health centers, and mental health centers. Again, if you're in a community with scarce resources, we're interested in helping you figure out how could you more efficiently use the resources you've got, the staff you've got, the funding that you've got, and the facilities that are available through collaboration. Partnerships outside the health sector are important too, through addressing, for example, housing needs and access to healthful foods. So we're very interested, for example, in partnerships that would bring in the schools and work on school nutrition or physical activity, or work with community developers to address housing needs in an area with little access to low-income housing. Just one point on the focus areas, you are absolutely free to apply for any area that you feel fits your project. We are taking really a pure guess, since this is our first call for proposals, that partnerships for better health, since it's kind of the broadest, may be the most competitive area, and it may therefore make sense to, if you're eligible for the Native American Indian focus area, that you, for the American Indian focus area, that you would apply for that, because it may be a little bit, there may be fewer applicants that you're competing against. If you have a primary focus on behavioral health, you may be in a slightly less competitive group if you apply there. And if you're seeking to address issues that fall outside of behavioral health and American Indian health, that you should apply for partnerships for better health. I'm going to turn it over to Ted Madden, who's going to go over for a few minutes just our online application system and talk to you about how to apply.
Good afternoon. So our main platform we'll be using is an online platform that can be accessed through our website. It is a third party, so you'll go to another website to log in and to administer your grants there. And this will be your login for both your letter of interest, if you're invited for a full call for proposals, and any grant reporting, both this year and in future years. So once you set up an account, that should establish you as a user in our system. There is a printout of the questions PDF, or you can download the PDF so you can complete the questions offline, but you will have to put them in on the online system. It is a national-based system, but fortunately they're headquartered right in Montana, so we have a local company providing our grants management. You will get emails from a grants administrator, not from the Montana Healthcare Foundation, once you set up your user account. So once you set up your account, make sure you check your spam filter if you're not getting confirmation of your new account. I'm just going to take a little time to do the 10,000-foot view of the application of the letter of interest and just go over the general sections and a little more detail on that. So our login page, the main access is on our website, mthcf.org. On the home page, upper left, you'll see a grants login page. There's other links in the website as well to access the grants administration program. First-time users set up an account. Should be pretty self-explanatory, login and password. And then once you have that account, you'll get a confirmation, and then you can just use that going forward. You'll get to the application page, and this is where you'll decide which of the 3 applications you'll want to apply for. And you'll see them highlighted in blue there and a short description of each of the different focus areas, and each of those will have a separate letter of interest attached to them. Once you get in there, you'll see the actual letter of interest, and you can see there's 5 sections: eligibility, organization information, project title and summary, demographic information. We really want to see where we're serving Montana and what populations, so there'll be some links there, general project description, and then a project budget. So under the eligibility, you'll just verify what type of organization you are and that you confirm how you'll be using the funds and the supplanting information as well, confirming that, and then putting your organizational mission down. From there, you'll go to a project title and summary, pretty brief explanation so we can sort all our different projects and get a quick capsule of what they entail. Next will be the demographic information. There'll be some check boxes there, also a link to a map so you know exactly what area you're serving and a description of those areas, or if it's a statewide project. And if it's also a reservation or an urban Indian project, you can designate there, and then other demographic information. Onto the project description. You'll describe your project, your activities, expected outcomes, also what partners are involved in completing the project, and from there also your plan for sustaining the project after the grant term ends. From there you'll see a general project budget. This one is important. It says you designate what the term of the project, what amount you're requesting from the Montana Healthcare Foundation, what other sources of funds, and any description of in-kind funds that are attached with the project. There's also a field for your total organizational budget. So there'll be a project budget and different funds for that, and there's one line so we can put a reference in there of how big your organization is. And then Erin will review the timeline, and then we'll get into the question and answer session.
Thanks very much, Ted. So the most important deadline for all of you to be aware of is June 30th. That's when the letters of interest are due. So again, letters of interest come in through our online application system that Ted just explained. We are aiming to make that as simple a process as possible. We are very happy to help you through getting those in, but just keep June 30th in mind as the most important deadline for this whole call for proposals. July 15th is when we are due to give decisions on the letters of interest. For the most part, those decisions will be that we invite full proposals or do not invite full proposals. Again, if you're not invited to submit a full proposal, please recognize that this is our first year and we're intended to be a permanent foundation. We are expecting to get a great number of great ideas. The interest in this call so far has been really high. So we hope you'll turn in all of your ideas and we will use those to structure our next call for next year. September 15th is when we'll have those who are asked to do full proposals to submit them. October 15th is when we will expect to notify applicants of the final funding decisions. Some applicants may need then to go to their board, or if they're a county agency, to their county board of supervisors to get approval. So we're anticipating the project would start sometime in November. Okay, I see that we've had some questions come in online. Please go ahead and submit more while we're doing the Q&A session. Again, use that Q&A feature on your WebEx interface to type your questions in. We will do our very best to answer all of them. We will try not to answer questions that focus on, will you fund my project, but more general issues. And again, don't hesitate to call us individually if we don't get to your question today.
Okay, our first question is the MSU College of Nursing eligible to apply under the American Indian Health Focus Area?
Okay, so I don't know enough about the MSU College of Nursing to know this, but I'll tell you the principles I would look at if I were you, and again, we can have that conversation offline as well if this doesn't fully answer your question. But you need to be either a tribal government agency or a Native-led nonprofit, so that would be, say, for example, a nonprofit or educational institution that has a majority American Indian board. You can partner with a Native organization, but the Native-led organization would need to be the grantee.
This next question is regarding, I believe, what we fund. If not, please let me know. So medical rehabilitation research that is demonstrated to be directly related to and targets the health of Montanans. Example, tobacco use cessation.
So it's a tricky distinction to make between research and programming. There is now a growing field of community-based participatory research and action research that really does focus on serving the needs of a community, delivering a program which has every expectation of being effective, at the same time as doing research to make sure that it is optimized to be as effective for that particular community as possible. That sort of program, a program that actually delivers a service to a community in Montana, and that service is expected to be effective, is eligible for funding. Something that is more on the pure research side, where it's asking an open-ended question. We don't know if it will work or not. We really have no reason to hypothesize one way or the other. We're less likely to fund that sort of higher-level research. I hope that answers your question.
Would projects that support quality early childhood education and assistance to families to help them pay for quality early childhood education be considered as a project to address adverse childhood experiences?
We'll be walking a tricky line, particularly in the Partnerships for Better Health portfolio, but to some degree across all of these focus areas, recognizing that social, economic, and educational circumstances have a profound impact on health. So will we fund housing? Will we fund education? Will we fund job creation programs? The answer, I think, we'll learn more as we see what types of proposals we get. What I would suggest to you is that you really focus on our selection criteria. is this early childhood program, is there evidence that it's specifically going to improve the health of the recipients? Are the recipients a high-risk population? Is there evidence that links the early childhood intervention that you're talking about directly to better health outcomes? That's the sort of question that we'll be asking as we evaluate these. And I think that this may not answer your question specifically, but I hope it gives you some guidance on how to think about doing a proposal in that arena.
Can I please get some further clarification on who is eligible to apply for the American Indian Health Grant? Can a non-native-led organization partner with an American Indian nonprofit?
Absolutely, but again, the American Indian-led nonprofit needs to be the grant recipient. In the budget, you can propose to have a subcontract or even potentially a sub-grant to the non-native partner, but we'll be looking to make sure that those aren't just pass-throughs. We want the funding for American Indian Health to really be going to native-led projects that derive a substantial benefit from our grant. And if they need a partner that doesn't meet those eligibility criteria to make the project successful, that's fine. But if it appears to be sort of wholly passed through to the non-eligible applicant, we might not look on that one as favorably.
This question is for Ted. Does the budget go in at the same time as the LOI or later if we are invited to submit a full proposal?
The LOI just has a general budget with general categories. The full proposal will ask for additional detail, but for the letter of interest, it's just the questions asked. But if you are invited for the full proposal, there will be additional detail required.
Do partners included in the grant have to be nonprofits also?
No, they do not. Again, pay careful attention to the pass-through question. We would not look as favorably on a proposal that had a nonprofit grant recipient proposing to spend 95% of the funds on a for-profit. But if there's a reason that you need a partner in the project that is a for-profit, and you've clearly explained that reason and why they're the best organization for the job, that is an acceptable use of part of the funding.
Will you be accepting CFPs annually or every other year?
We expect to do this annually. Multi-year budgeting for foundations is somewhat challenging because we're required to pay out a certain percentage every year. Our goal right now is to be making these annual.
I will be joining the College of Nursing MSU faculty this fall. Given that I am not currently faculty, can I still apply for this funding? I am a substance abuse researcher who evaluates novel treatment approaches for comorbid substance use disorders.
Well, I think that you could certainly be listed as a PI and explain the situation that you wouldn't be coming on until after the application deadline, but would be on board before the grant starts. And then all of the details about funding would come clear in the budget process. But you would not be eligible to apply as an individual. Your school should apply with the anticipation that you would become the principal investigator.
Do you have, or could you please provide a Word or PDF version of the application form that shows all the data you're wanting to collect and the character limits for each narrative box so we can prepare for all questions offline?
On the grants administration program, there is a way to print off a PDF of all the questions, and that should contain the character limits as well. And so once you get into the grants management system, there is a link there to a PDF of the full application.
Should we send that out to the group afterwards? I realized I was wondering about that myself and hadn't looked at the system to figure out if I could do it, but sure. If it's not totally obvious, maybe we should send it out. Okay.
Will you fund IT if it offers small BH providers a way to improve their agency business practices?
I think the key is we don't want grants going to fund pure technology. If the technology is a critical part of a program that you're looking to implement and it's not a major portion of the budget, or not a majority of the budget, then that, I think, is an acceptable, part of a budget. We just are not going to fund a program that, for example, would deliver, 500 new laptops to, if that's really what the majority of the funding would be used for.
If I understand right, the grant asks for any other funding sources and or in kind. Is there any requirement for matching dollars?
There is no requirement. We think of this as a way to understand both the institutional commitment and the chance for sustainability after our grant. We will look at it as part of the way we evaluate the strength of a proposal, but there's no threshold. We anticipate funding projects that may have no match or in kind. But again, when we look at that, read the selection criteria carefully, and particularly the one that deals with sustainability, we'll be looking for a realistic plan for sustaining the efforts after the grant, and sometimes that comes from having multiple sources of funding or an in-kind contribution.
Will you accept several applications from one not-for-profit?
The limit is up to 2 per organization.
Will you fund a statewide medial campaign if it targets a specific targeted behavioral health problem?
So I think in theory that could work, but again, to turn you back to the selection criteria and ask you to read those carefully, think about what evidence base you'll bring to bear to show that this will be an effective way to address the health issue that you're seeking to address.
Will you fund specific statewide training programs which will increase behavioral health professionals' knowledge and skills and improve care outcomes?
And again, I want to be careful on this call for the last couple of questions about representing that we will or won't fund any specific projects before we've seen the proposal on paper. But in theory, a project that let me read this again. So a specific statewide training program that would increase behavioral health professionals' knowledge and skills to improve care outcomes. I think that again, we'll be looking for the evidence that shows that education and training program is going to improve outcomes. There's a lot in healthcare that involves adding things to people's lists, and without a lot of evidence that they can take on the extra work or the extra knowledge effectively. So we'd be interested in knowing, if you're proposing that, what is the evidence base that this actually results in a change in the way that people are practicing and a sustainable one.
Do you provide support for permanent endowments?
No.
How often do you anticipate that the focus areas will change?
We believe that each of the focus areas that we have chosen represent among the most important and longest standing health challenges in the state. We've not made a specific 1 or 5 or 10-year commitment to any of these, but on the other hand, the trustees and staff well recognize from our conversations with stakeholders that none of these focus areas are things that we'll be able to make substantial progress on in just a year or 2. I anticipate these are going to be long-standing areas of focus, but our strategies within them are likely to evolve, and we may well add other issues as well.
Will you involve a public professional grant review committee in the LOI and application review process?
The LOIs will be screened by staff according to the selection criteria. The full proposals, we've not yet determined the entire review process. Our trustees will be the ultimate decision makers. We may or may not find it necessary and beneficial to involve other outside reviewers. And we'll certainly let applicants know once we've made that decision. I anticipate we'll be deciding on our full proposal review process once we've received the letters of interest and reviewed them. Okay, I think that's the end of our question list, but we're going to stay on. We're 15 minutes before the end of the hour, So I think we'll stay on and make sure that, that everybody's gotten a chance to ask their questions.
I have another one. Are 501c6 organizations eligible?
We'll need to get back to you on that. I don't know the answer. Let's see, I think here's one. Can American Indian health and well-being related interventions be not only medically/nutritionally based, but also culturally based? Absolutely. You may notice in the American Indian focus area description in our call for proposals, we really call out the need to make interventions with tribes culturally based, because we recognize that a substantial body of literature shows that those are much more effective with tribes. So yes, you should make your argument on why that would be effective and what the cultural adaptations are, but absolutely yes. Okay.
I have a couple more.
Yep.
Would the Montana Healthcare Foundation consider funding a youth mentoring program under the behavioral health focus area if the program can show positive outcomes of avoiding drugs, alcohol, and delinquency in area youth?
So I'll make the same caveat that I made for a couple of the other questions about a specific project. Nothing in your question tells me that it's something we would not consider, but we won't be, nothing that I'm saying on this call today is meant as an indication that we will fund you. You should submit a proposal. Again, just paying careful attention to the selection criteria and making sure that you're making a strong case for why that intervention that you have in mind is effective and is the best way to meet the needs of the community.
You said there is a limit of 2 submissions per organization. Does that mean a large state agency needs to prioritize their submissions and only submit 2, or do you mean each PI can only submit 2?
We recognize that organization has a lot of different definitions, and universities have different departments, state agencies have different divisions, and so we haven't fully defined this as yet. I think at this point, the safest thing for you to do is to plan on 2 applications per organization. If that's a state agency, then you should limit your applications to 2. If that answer is not sufficient, then I'd suggest you consider putting together all the proposal ideas from your institution and having an offline conversation with us about how to handle different divisions of your department, different colleges, what have you. Again, this is our very first call for proposals, so we're learning on our feet here. We want to make sure we give everyone an adequate chance and don't favor the very large institutions.
How are the Foundation's assets and award budgets projected to grow in the next handful of years?
The fact is we don't know exactly. The sale of Blue Cross and Blue Shield of Montana has been completed. The assets, the total assets from that transaction were in the neighborhood of between 150 and almost up to $200 million. Currently, we have $80 million of that amount. The remainder is in a holding company, and there is some litigation that's being resolved around the sale and the old operations of the old Blue Cross. We don't know what the outcome will be, and we don't know exactly when those cases will be decided. So we do anticipate that we'll grow somewhat over the next year. And again, we'll be making grants and grant-related investments of roughly 5% of the value of our trust each year.
Do you consider developmental health, cognitive, not necessarily physical, as an eligible health category?
Yes, I think so. I think I would put that in the category of behavioral health, but I think we'd be interested to see the specific health issue that you're hoping to address how it's important to, how important is this to the health of Montanans? How does your project meet the needs of Montana communities in an effective way?
Would you consider operational assessment and infrastructure development initiatives as they relate to rural frontier communities to demonstrate the financial sustainability of collaborative efforts between the community stakeholders?
Well, honestly, I'm not sure I fully understand that one as it relates to either, partnerships for better health or behavioral health and our encouragement that people really look at partnerships. I think operational assessment and infrastructure development are perhaps relevant, but I think we probably would need to understand a little bit more about the specifics. Again, let me make a point here. There's a lot of specific questions where I'm referring people back to the selection criteria. My hope is that the letter of interest is simple enough for people to fill out, that may be almost your best way of answering, of asking the question. In other words, if you're not sure it's something we're interested in funding or not, but by the time you've typed out a detailed question for us, maybe you could have filled out half of the letter of interest. Do it that way, and then we'll be able to really understand the nuts and bolts of what you're hoping to do and whether it is something that we can consider funding.
Would you be interested in projects that work with federal partners like the Substance Abuse Mental Health Services Administration? They currently are looking to partner on projects that involve workforce development.
I'm sorry for the phone ringing in the background. We can't fund federal agencies. However, partnerships that involve funding from SAMHSA or some other collaboration with federal agency, absolutely, they certainly could be a great partner. We're combing back through to make sure we've answered all of your questions. Please do feel free to keep typing questions in. And again, if we didn't fully answer a question, you're welcome to call or email us afterward.
I have another one.
Okay.
If the focus of a project is sensitive or proprietary, may we expect the Montana Healthcare Foundation to protect the ideas in our submission?
My knee-jerk reaction is yes, absolutely. I think it may be worth a separate call. That's not a question that's come up in my experience before, and we might just also run it by our counsel and make sure that there's no reason for which we might be called upon to make it public.
We had a couple of questions about where to find different things on our website. Please email me directly for that, and I will walk you through it, or call the office, and I'd be more than happy to walk you through that.
And I think we will try to send out that one link to how to download the PDF, because I think that's probably a pretty general, common question. Yeah. Well, let's see here. It looks like another one came in. Any guidelines versus allocation of grant funds to salary versus other uses? So I think, generally speaking, no. You are welcome to propose any allocation that seems reasonable within the guidelines we've already gone over. We don't want pass-throughs where 95% of the grant funds go to a non-eligible entity like a for-profit. But you can have a for-profit partner. One thing just to think about, if we're creating a new staff position with your grant, the answer to the sustainability questions are going to be very, very important. We're going to be less likely to fund a program where you're creating a new staff position and your plan for sustainability is we'll apply for more grant funds in a couple of years, because that's not a secure you know, an approach, and we'd hate to create a position that then loses funding. If you're looking at, well, you know, we've got a hospital partner in the corrections system, and we anticipate we'll be able to split this position if the pilot is successful, that may be more a stronger, more robust sustainability plan. So again, think 2 steps ahead to what happens when the grant is over. And I think as long as the budget reflects a reasonable consideration of what you need to get the project done and how you're going to sustain the efforts after the project, we don't have any specific guidance on salary versus other uses.
I have another question, and I think it refers to something that we've talked about before, but maybe if you could just restate. Is it possible for an entity to apply for more than one grant or simultaneous grants in 1 year?
You can apply for up to 2 grants during this call for proposals. 1 organization, up to 2 proposals. Okay. Anyone else have questions? These have been great. I hope they've been helpful to all of you. We've got a couple more minutes left, and we're happy to stay on if other people have others. Okay, well, again, our real goal with the webinars and with whatever we can do between now and June 30th is to make this easy for you. We think that the letter of interest process should be as painless as possible. It should be an opportunity to clearly articulate a good idea for yourself and for us, but not something that takes so much time that it's not worth the trouble if you're not sure you're going to get the grant. We expect we'll get quite a few letters of interest based on what we're hearing from around the state. But again, we hope that those are easy to do, and if you're having trouble with any particular question or you just want to brainstorm something with us one-on-one, you're welcome to call. We really appreciate your interest. Okay, everyone. Well, I'm not seeing new questions, so thank you all very, very much for taking the time. And we'll post the archive of the webinar on the website as well as the slides, and be in touch. Look forward to seeing all of your great ideas.